back to another Doc Talks. My name is Dr. Booth and this is...
Hi, I'm Dr. Butcher.
And today we're going to talk about the common myths that's kind of around adjusting a spine or other parts of the body. We have a couple of myths that we want to just make sure that you guys understand is not true and give you a couple of reasonings on the way that we like to manipulate the body. So first off, what's our first myth that we're going to bust up here?
Yes, one of the most common myths is we are bone setters or setting bones or putting things back into place. I hear so often like, hey, I need something put back into place. And just off the bat, that's not the case. That's not why we're doing what we do. So if we had to put something back into place all the time or frequent, or whenever you have discomfort, I mean, that would just tell us your body is really unstable. Like that's not a thing. And if something that we did was able to put it back into place, you'd be walking around all the time, things getting out of place, then moving back into place. And that's just not, your body is much more stable than that. Your body's not fragile. It's not, things are going in and out of place all the time. So that's not the case. More so what's the case is we are going to manipulate your joints, trying to improve mobility at that joint, as well as it has a therapeutic effect to the surrounding muscles and the nervous system and things that might just be kind of holding down, constraining, restricting movement either very specifically or kind of even globally, we know. So not putting bones in place, but what we're doing is we're putting in a manipulation into a joint, and then usually what is happening is that joint undergoes some pressure. When there's a change in pressure, gas is formed, and a gas bubble can form inside and then pop. I kind of refer to like Rice Krispies, or almost like, think of it like soda, kind of carbonated bubbles, you know. So sometimes with enough force and then a pressure change, gas bubbles form, and then sometimes they pop. And that is something that we call cavitations. So when you hear those pops, again, just little gas bubbles that are coming from inside the joint with a little bit of pressure, popping.
Yeah, and then it just kind of goes into the bloodstream. It's shuttled out of the body. But like you said, it's very therapeutic sometimes to get a release and actually hear it. Patients tend to respond well to that. So that pop is definitely not putting a bone back into place. Hey, my rib's out. We're not putting it back in. We're actually just inducing more motion that might be a constrictive joint. Myth number 2. This one really hits home with us, and when we were going through school, we actually had a lot of education on this because it's kind of a popular one. Is neck adjusting safe? So you see in the karate movies, people getting their heads, spun all the way around and breaking necks and stuff. And that's typically what makes people there's a lot of fear that gets induced with that. And then there's also some stories that you'll see that, they got an adjustment and something bad happened. That's been proven in research that there's not a massive correlation between chiropractic adjustment and anything bad happening. The most significant injury that can potentially happen there is just having a ligament that would be overstretched, and that might cause some pain, but most of the time, given the skill of the practitioner, there's going to be an extremely safe procedure that happens when you're getting neck adjusted. So the research definitely backs having it be a very safe and therapeutic intervention for neck pain, headaches, upper back aches. So if anybody has something bad to say about that, they can always reach out to us and we can kind of go through the literature on what it actually says about safe or unsafe neck adjusting.
Yeah, exactly. And I have a lot of patients that sometimes already know what being a neck adjustment feels like because, hey, they say they do it at home. But then again, I kind of like to educate, like it's not necessarily safe how you're self-adjusting yourself at home. We're trained for very specific techniques. We're not doing extremes of anything. We're just kind of briefly getting in there, kind of using whatever technique we have to just quickly in and out, kind of mobilize the area. So a lot of times when we're even just yourself doing something at home, you're putting a lot more stress and strain on something, you're hanging out at end range really long, and that can be definitely an unsafe situation. So I encourage all you self-adjusters at home even to try to dial back on that too. Get some trained hands on you.
Huge.
Yeah. Myth number 3 is chiropractors are the only people who adjust, mobilize, manipulate the joints, and that's not true either. As much as we are very much known for that, our physical therapists do, especially ones here at our facility, and just a lot more physical therapists around are becoming very trained in adjusting and manipulating the body as well. DOs, or doctors of osteopathic medicine, do a lot of manipulations too, and even MDs gain, their education and learning how to do adjustments because, again, very therapeutic, very safe, very minimal, not invasive. It's very, very good, very great start in getting the body feeling better. So not just us, but there are a lot of other professions that are actually able to adjust and manipulate the body as well.
Yeah, and we definitely want to make sure that we're just trying to have the best practices for pain modulation. So like she said, our PTs that are on our team, they can use it, we can use it. It's all just a tool just to make sure that the patient is getting to where they need to get to at a lesser pain level. No big interventions as much as like surgeries and medications, trying to stay as far away from that stuff as we possibly can. But adjusting is just another tool. And then another myth is it, if I don't hear a pop on my adjustment, is it beneficial? Yes, absolutely. There's definitely times, so the goal of adjusting, like we said in the beginning, is trying to induce motion at a joint. If the gas pressure isn't built up enough and there's no crack or pop, you're still, as a practitioner, you're still inducing more mobility at that joint very quickly. Have a nice big stretch on the capsule, and if it doesn't pop, that's okay. You can still reap the benefits of that. I've had plenty of patients where we get through a mobilization, there's not an audible pop, but then at the same time we come back and it's like, oh my gosh, I can now move my head 10 more degrees, or whatever their outcome marker was. We retested it and it's better. So that pop is not always necessary.
Yeah, a lot of mobilizing too, it doesn't necessarily have to be what we call high velocity, low amplitude. There's different ways to kind of force, some movement in the joints, working the capsule, kind of stretching out in different directions. And with that being the case, you won't always get that quick change in pressure, that quick gas bubble release. So you won't always get that pop.
Yep. And last one.
Yeah, last myth here is that, hey, I come in for chiropractic work because I need my back and neck checked out, but we don't only adjust the back and neck, we also do anything, really anything, a part of your body. We do hands and wrists, shoulders, elbows, knees, feet, ankles, hips, everything. I mean, your body's composed of lots of joints across the board, and we manipulate all of them. So any kind of injuries, ankle sprains, impingements in the shoulders, wrist aches and pains, elbow issues, we can adjust all of it, not just the spine.
So looking at those joints, we assess it just like we do the spine. We'll go through, we'll put our hands on a patient, we'll see what kind of range of motion that they have at that joint. If it feels restricted, if it feels kind of clunky, then we'll see if we can kind of restore more motion to those joints with a quick adjustment, trying to get in and out as quickly as possible, and make a big significant impact for people that have joint issues that aren't just the spine. I typically have a lot of runners that respond really well to foot and ankle adjusting. They typically tell me it feels like they're walking on clouds and stuff afterwards, because it just releases all the pressure of the constant pounding from running. So those are a couple of the myths that we really wanted to get out to you guys. If you guys have any more questions about them, or you're concerned, reach out to us at 702-558-2151, and we'll be sure to answer your questions. And if you want to experience your adjusting or get some joints moved around, let us know and we'll get that taken care of for you too. We'll see you guys.